Good morning, class. Today, we will be delving into the fascinating world of the influenza virus, exploring its structure, function, replication cycle, and the various complications and implications associated with infection. By the end of this lecture, you will have a comprehensive understanding of the influenza virus and its impact on human health. The influenza virus hemagglutinin protein is essential for the virus to enter host cells. It attaches to sialic acid receptors on respiratory cells through its receptor binding domain, initiating infection. Neuraminidase inhibitors are important antiviral drugs for treating influenza infections. They block a viral enzyme called neuraminidase, which is crucial for the release of new virus particles. However, the rise of drug resistance presents challenges that require new approaches and constant monitoring. The H1N1 pandemic influenza, also known as swine flu, emerged in 2009 and quickly spread worldwide, causing significant morbidity and mortality. This topic explores the epidemiology of the H1N1 pandemic, including its origin, mode of transmission, and global impact. We will also discuss the lessons learned from this pandemic, highlighting the importance of robust surveillance systems, rapid response strategies, and effective public health interventions in controlling future influenza outbreaks. In severe cases of influenza infection, individuals can develop a life-threatening complication called influenza-associated respiratory distress syndrome, IRDS. This topic focuses on the pathogenesis of IRDS, including the dysregulated immune response and the role of inflammation in lung tissue damage. We will also discuss current treatment options and potential therapeutic targets for managing this condition. Understanding the intricate details of the influenza virus replication cycle is essential for developing effective antiviral strategies. This topic provides a molecular perspective on the various stages of the replication cycle, including viral attachment, entry, uncoding, genome replication, protein synthesis, assembly, and release. We will emphasize key viral proteins and host factors involved in each step, shedding light on potential targets for antiviral drug development. Severe influenza infections can trigger an exaggerated immune response known as a cytokine storm, leading to excessive inflammation, tissue damage, and organ dysfunction. In this topic, we will explore the immunopathogenesis of cytokine storms in severe influenza cases, focusing on the role of pro-inflammatory cytokines, immune cell dysregulation, and the delicate balance between viral control and immune-mediated tissue damage. Additionally, we will discuss potential therapeutic approaches aimed at modulating cytokine storm severity and improving patient outcomes. The hemagglutinin protein of the influenza virus is prone to antigenic drift, a gradual accumulation of amino acid substitutions that enable viral evasion from pre-existing immune responses. This topic delves into the mechanisms underlying hemagglutinin antigenic drift, emphasizing the importance of continuous surveillance and strain selection in seasonal influenza vaccine design. We will also discuss the challenges associated with predicting antigenic drift patterns and developing broadly protective universal influenza vaccines. Influenza viruses can undergo genetic reassortment, resulting in the emergence of new strains with pandemic potential. This process involves the mixing and matching of viral segments from different subtypes within infected cells. Factors influencing reassortment and strategies for mitigating its impact will be discussed. Although primarily recognized as a respiratory pathogen, the influenza virus can also invade the central nervous system, causing influenza-associated encephalitis and other neurological complications. This topic focuses on the pathogenesis of influenza-associated encephalitis, exploring viral neurotropism, inflammatory responses in the brain, and potential mechanisms driving neurologic damage. We will also discuss clinical manifestations, diagnosis, and current treatment strategies for managing these severe neurological complications. Individuals exhibit a wide range of susceptibility and severity to influenza virus infections, and host factors play a significant role in this variability. This topic examines various host factors influencing influenza virus susceptibility, severity, and disease outcomes. We will discuss genetic, immunological, and environmental factors that contribute to host-virus interactions, potentially paving the way for personalized approaches to influenza prevention and treatment. Animal models play a crucial role in understanding the pathogenesis, transmission dynamics, and testing of potential therapeutics and vaccines for influenza viruses. This topic explores different animal models commonly used in influenza research, their strengths and limitations, and the insights gained from these studies. We will also discuss the ethical considerations surrounding animal research and the importance of their judicious and compassionate use in advancing our knowledge of influenza. Pregnant women represent a vulnerable population at increased risk for severe influenza-related complications. This topic delves into the benefits and risks associated with influenza vaccination during pregnancy, including the impact on maternal and fetal health. We will discuss the immunological changes during pregnancy, vaccine safety data, and the importance of influenza vaccination in protecting both the pregnant woman and her developing baby. To conclude, the influenza virus remains a serious risk to public health. It requires ongoing research, surveillance, and innovative strategies to prevent, diagnose, and treat. Understanding the virus helps us develop effective vaccines, antiviral drugs, and interventions. Thank you for your attention and participation in this lecture. I encourage you to continue exploring the connections between microbiology, immunology, and clinical medicine in the fight against infectious diseases. Have a wonderful day.